If you think someone might be choking, find out if the person can speak, breathe, or cough. Hit them firmly on the back up to 5 times. Quickly check to see if anything has been coughed up. If they are still choking after 5 back hits, shout for help. Ask someone to call 999 for an ambulance or do this yourself. Keep giving them back hits until the thing that is causing the choking moves or comes back up, or emergency help arrives.
Keep coughing. Are you choking? Call 911. She's choking. May I help your child? I know what to do. Don't be afraid. I'm going to help you. Okay. Lean forward. 1, 2, 3, 4, 5.
When a conscious child can no longer cough, speak, or breathe, she may be choking.
1, 2, 3, 4, 5.
We give back blows and abdominal thrusts to help push the object out of the airway. Do not try this on your partner. Ryan is only simulating back blows and abdominal thrusts. What we can safely practice with our partners is how to position ourselves in relation to the child who is choking and how to find the correct hand placement for giving back blows and abdominal thrusts. Let's say Katie has just swallowed a piece of candy and it's stuck in her throat. Her body's natural response is to cough forcefully to get the object out. If the child is coughing forcefully, she's still getting oxygen. Encourage her to keep coughing.
Keep coughing.
But if a conscious child can no longer cough, speak, or breathe, she may be choking. Have someone call for help, then obtain consent to provide care from a parent or guardian. Choking is a life-threatening condition. So if no parent or guardian is present at the scene, do not delay care. Act immediately. Use back blows first to help dislodge the object.
Are you choking? Call 911. This child's choking.
It helps to be at the child's eye level.
May I help your child? I know what to do. Don't be afraid. I'm going to help you.
Talk slowly and calmly using simple words.
Okay. All you responders, follow my lead and do only what I tell you to do. You're going to stand behind your partner as I kneel behind Katie, but everything else will be the same. We've just confirmed that a child is choking, and we have consent to help. Get in position to give 5 back blows to try to clear the airway. Stand or kneel slightly behind the child. Provide support by placing one arm diagonally across the chest and lean the child forward. Bend forward. Just watch me do the next part. Do not give back blows to your partner. Using the heel of your hand, give 5 forceful back blows between the shoulder blades. 1, 2, 3, 4, 5. Each back blow should be a separate attempt to get the object out. Now, without using any force, I want you to gently place the heel of your hand on your partner's back between the shoulder blades like this. Your classroom instructor will take the next few moments to check your position while we take a short pause. If the 5 back blows do not get the object out, give 5 abdominal thrusts. You can follow along here, but again, do only what I tell you to do. Use one hand to find the navel. Make a fist with your other hand and place the thumb side of your fist against the middle of the abdomen, just above the navel. Got it? We're going to pause again for a moment to allow your classroom instructor to see if you're in the right place. Remember, don't put any pressure on your partner's abdomen. Now that you have your fist in the right place, grab that fist with your other hand. This is the position you want to be in to give abdominal thrusts. Now let go of your partner and take a step back. I don't want you to give any actual thrusts, but watch carefully as I show you how it's done. Pull upward quickly with each thrust. Each thrust should be a separate attempt to force the object out. Lean forward.
Continue giving 5 back blows and 5 abdominal thrusts until the object is coughed up, until the child starts to breathe or cough forcefully on her own, or until the child becomes unconscious.
If the child loses consciousness, gently lower her to the ground, taking care to protect the head all the way down. You will learn what to do for an unconscious choking child in another lesson.
If you have any questions about when or how to do abdominal thrusts, ask your classroom instructor before you practice any further.
You know, an infant choking can be a pretty scary experience for most adults. Hi, I'm Captain Joe Bruni, and what I want to talk about is the steps to take when an infant is choking. When an infant is choking, take the infant and place the infant on the forearm with your hand running up the back to the head. Support the head. The infant can then be laid down over top of a bent knee and, supporting the head, deliver back blows to the infant to try and dislodge whatever it is that's in the throat region. 5 back blows between the shoulder blades should be delivered. If that does not clear the obstruction, rotate the infant over to the other forearm and deliver chest compressions at the rate of 5 to the middle of the breastbone using 2 fingers. After delivering the compressions, if the obstruction has not cleared, rotate the baby back to the original position on the leg, supporting the head, and deliver 5 more back blows. Continue to deliver back blows and chest thrusts or compressions until the object clears or the infant goes unconscious. If the infant goes unconscious, cardiopulmonary resuscitation may have to be started. I'm Captain Joe Bruni. Stay safe, and we'll see you next time.
An infant who is choking cannot cough, cry, or breathe. If the infant is coughing forcefully, let her keep coughing. But if a conscious infant cannot cough, cry, or breathe, assume the airway is blocked. Act quickly to clear the airway. Have someone else call for help, then obtain consent from a parent or guardian if present. Give a combination of 5 back blows and 5 chest thrusts to force the object out of the infant's airway. To give back blows, place the infant between your forearms, supporting the head, neck, and back. With your thumb and fingers supporting the infant's jaw, position her face down along your forearm, with her head lower than her chest. In this position, gravity can help dislodge and expel the object. With the heel of your other hand, give 5 firm back blows between the infant's shoulder blades. Be careful to keep your fingers up so you don't hit the infant's head. To give chest thrusts, support the infant between your arms and carefully turn the infant over so she is face up along your other forearm. Lower the infant to your nearest thigh. Place the pads of 2 or 3 fingers in the center of the chest, just below the nipple line, toward the infant's head. Give 5 chest thrusts, each about 1.5 inches deep. You can give back blows and chest thrusts effectively whether you stand, kneel, or sit, as long as the infant is supported on your thigh and the infant's head is lower than the chest. Continue to give sets of 5 back blows and 5 chest thrusts until the object is forced out, the infant can cough forcefully, cry or breathe on her own, or the infant becomes unconscious.
You know, an adult individual choking on something that is obstructing their airway can be a pretty scary experience. Hi, I'm Captain Joe Bruni, and what we're going to talk about is the steps to take with a choking adult. Most adults that are experiencing an obstructed airway will display the international sign of the hands across the throat. The first step is to ask the person, "Are you choking?" And they will acknowledge if they are. The next step would be to perform abdominal thrusts sometimes referred to as the Heimlich maneuver. By placing the hands around the person's abdomen and forming a fist with one hand with the projected area of the thumb into the middle of the abdomen, slightly below the sternum or breastbone. Grasp that fist with the other hand and deliver sharp upward thrusts into the victim, forcing air up and out of the lungs and hopefully causing the obstruction to be dislodged. A choking adult can have a pretty scary experience, not only for themselves, but for bystanders that are in the general vicinity. I'm Captain Joe Bruni. Stay safe, and we'll see you next time.
When something is lodged in someone's throat, the natural response is to cough. If the person is coughing forcefully, he's getting air. Encourage him to keep coughing. If a conscious adult or child can no longer cough, speak, or breathe, he may be choking. Have someone call for help and obtain consent. A conscious adult or child who has a completely blocked airway needs immediate care. Using more than one technique is often necessary to dislodge an object and clear a person's airway. A combination of 5 back blows, followed by 5 abdominal thrusts, provides an effective way to clear the airway obstruction. To avoid injury, never give actual back blows or abdominal thrusts to someone who is not choking. These techniques are simulated for training purposes. Provide support by placing one arm diagonally across the chest. Bend the person forward at the waist so his upper airway is at least parallel to the ground. This will help ensure that the object will not go back down the person's throat. Using the heel of your other hand, give 5 firm back blows between the shoulder blades. If the 5 back blows do not clear the airway, give 5 abdominal thrusts. Standing behind the person, use 1 or 2 fingers of one hand to find the navel. Make a fist with your other hand and place the thumb side of your fist just above the navel, in the middle of the person's abdomen. Grab that fist with your other hand. Give 5 quick, upward thrusts. Continue to give 5 back blows and 5 abdominal thrusts until the object is dislodged, the person can cough forcefully, speak or breathe, or the person becomes unconscious. If the person becomes unconscious, gently lower him to the ground, protecting his head on the way down. You may need to kneel behind a child to give effective back blows and abdominal thrusts. Do not use as much force with a child.